which is the North Country Telehealth Partnership-sponsored Fort Drum Regional Health Planning Organization and Adirondack Health Institute, for those of you that don't know. As you can see on the screen, I'm sharing the agenda. We always start with a quick update from our government leaders, and then we usually have a presenter. Today's going to be Mary Zelazny, who's the CEO of Finger Lakes Community Health. Then we have a few little last-minute agenda items. We will try to get through this as quickly as possible. I know that today is the solar eclipse, so we want to give everybody an opportunity to try and scooch outside and see that, because it is coming through, you know, most of our areas in about 45 minutes. So I'll be respectful of everyone's time. I certainly want to see it myself, so we'll be quick. So let's get started. First on our agenda is an update from the New York State Department of Health. I am not seeing Rayanne or Joan Sicard on the line, which is okay. If they happen to join later, we can pull an update from them. Just to give you a quick, brief overview of that regulatory modernization initiative, that is a set of meetings that are going to be coming up soon that are kind of inspired by the Department of Health. And what they are, there's one that's focusing on telehealth specifically, and stakeholders can weigh in. There's 8 groups total. Again, one of these is focused on telehealth. I believe Mary Zelazny is co-leading that, and maybe she can speak to that a little bit more. And I believe the first one is going to be on September 5th. So we'll find out more about that if Rayanne comes on and can speak more to that, or maybe Mary can speak more to that when she presents. Moving on, OMH, I'm not seeing Amy Smith on here. You know, I do see Michael Vitale on the line. Michael, I'll give you the opportunity to speak to anything going on in your department related to telehealth if you'd like, but you are by no means bound to say anything. And I sent him his PIN, so if he wants to dial in, I'll give him a second to do so. Otherwise, we'll move on. Okay. All right. Well, Corey, if you could make Mary Zelazny a presenter, we'll move on to her presentation. And I just got word that our Department of Health contact, Rayanne Aguilera, might be on vacation this week, so that's more than likely why she's not on the line. Thank you, Andrew, for letting me know.
And Mary is the presenter.
Okay. So Mary, you're welcome to, I'm going to stop screen sharing now so that you can go ahead and open up your presentation.
Okay, how's that? Can you guys hear me now?
Yeah.
Yes, I can.
Okay, great. Hi. I'll do this as quickly as I can because I know there's my daughter's in Oregon and was able to watch the full eclipse, so it's very cool. Okay, I wanted to just give you guys an update on where we're at with telehealth. You know, we've been using it for a long time, and we've really tried to find ways to put telehealth into everything we do so that we can really provide better care for our patients. So who we are, we're an FQHC, Community Health Center program focused in rural areas. We serve farm workers as well as everybody else that wants to come into our sites. We saw about 26,000 plus patients last year, with a large majority of them wanting to be seen in a language other than English. And we provide a full, you know, all kinds of services, all in one-stop shopping. You know, as I said, we serve anybody that comes through our doors, so we run into a multitude of language issues, cultural issues, etc., that we have to try to address as we bump along, and telehealth has really helped us with some of that work. This is pretty explanatory. We've all probably know a lot of this stuff. The big thing for us that we really like about telehealth is the ability for it to reduce stigma. The ability for us to get some great education for our providers and our staff from the specialists that we work with. And it's really helping us gear up for value-based care, because it really will help us as we try to provide better care for our patients and outcomes. And now, you know, our next step, of course, is to try to get our partners to use it too, so that we're all on the same page. So cost-benefit analysis of telehealth for us, you know, there's a lot of benefits to it. We've decreased a lot of things, you know, all those things that cost our patients and force our patients to not potentially come in for their visits. And it's really helped us to access services that in the past haven't been easily accessible by our patients, particularly in rural communities. And for our providers, it's really given them the ability to talk, you know, one-on-one to consultants, to specialists. They've built up their skill set so that now we're referring the more difficult patients to our specialists, whereas we're able to treat some of our patients more readily in our primary care centers, because our providers now have built up their own skill set and also have that ability to always be able to call the specialists, because they have that great relationship now. It's been fantastic, particularly for rural communities. It's really important, because we just cannot get our patients into the urban centers. And there's a lot of peer-to-peer learning opportunities. We all know about Project Echo. It really helps. And also, we use it quite a bit, our video, for our, particularly for our mid-levels. If an MD wants to come in on a visit, or the mid-level wants the MD to come in, or maybe the counselor, whatever, they can come in and share in the visit. We've always built everything on a 3-layered platform, so I just wanted to mention that, because I just always want to tell people, you know, broadband is huge. You've got to have broadband, and it's not readily available in rural areas still. It's getting there, but it's not great in some places. So these are the programs that we're actually seeing clinically in our sites. Some of the big ones that we really have seen some real benefits for our patients, of course, with mental health, retinopathy screening. HIV and Hep C have been incredible, the benefits to our patients. And then, you know, we're doing PrEP, we're doing LGBTQ, because hormone therapy is really important for some of our transgender patients, and they can't get to the city to get their care, and there's also that stigma involved. So it's been really fantastic for our patients, and we've seen some really great outcomes. We use it a lot extensively with distance learning and provider meetings, etc., staff meetings. Every meeting we have at Finger Lakes has video available, so that people can call in, because we don't want people to, if they can't come to a meeting because of travel, we don't want that to be a barrier. And we've saved, just in our one meeting, we watch it every year, we save about $56,000 annually, and it goes inches up every year, because we're able to hold all of our provider meetings, our monthly meetings, by video, and it's just saved us so much time, and we have more time for them to see patients, and they're not traveling around, there's not that risk, etc. So I just want to give you some updates on where we're at in terms of our finished product. Where, you know, what have we seen in terms of benefits of these programs in our own primary care site. Telepeds Neurology, we work with the University of Rochester. We see the mid-level, and we also see the MD. These kids come back into the primary care setting, and we have chosen in the beginning of this program, we had the primary care provider present the child up to the specialist in Rochester so that they can get that skill set, help, and now we've been doing it long enough where our seasoned providers have the RN present the child to the neurologist. But the outcomes have been really great for our kids. They, decreased time for treatment. They've really done a good job of fine-tuning those medicine regimens that the kids get, which is huge. And most importantly, our data is showing us that 63% of these kids have shown improvement in function at school and at home. The parents really like it because they get their care and they don't have to get up to Rochester, which was always a challenge for them. And this has been a great program. We do a lot of case conferencing and really watching those kids, following them along. And now what we've done is tried to get the school social worker to come in on these visits with the pediatric neurologist so that we're all on the same page, all talking about the same plan, etc., so that it's really, everybody that's involved in that child's care looking at the child at the same time, hearing the same thing, which is always good. Our HIV program, what happens is our patients come into our centers and they are able to see the ID clinic up in Rochester. We use Trillium Health. They're a Ryan White grantee. They're experts in HIV, particularly Hep C, PrEP, all that stuff, and they've been a fantastic partner to us and really helps our patients because out here there's huge stigma, of course, with HIV, also Hep C, although not quite as much, but it's been a great program. If you look at our data, we track our data, we do registries on all our programs. What's interesting about this is you'll see where our baseline is for in 2013 when we started this program, and we saw some improvements. And then in 2016 we changed providers, and you can see that some of our metrics, the red, went down because we have to train those providers. So it's been really interesting for us to see how this is affected, really tracking that data, using our data to drive our decisions. But what we're really happy about is that 76% of our patients have a negative viral load now. So we're pretty happy about that because that's where you really want to be. We also do Hep C care, and this is interesting because we're seeing Hep C in our baby boomers, of course, because we test, but also because of the opioid problem. And one of our counties, Yates County, we have we're number 2 in the state per capita for problems with opioid dependence and overdoses. So this has been really important for us to try to help some of these folks with not only their care, but also their substance use problems, mental health problems, etc. But really great outcomes. We've been really surprised by the outcomes in this program ourselves, actually. And if you can see here, the blue is the face-to-face data that we have had, and then the red shows for our Hep C program the success that we've had with our patients in terms of outcomes. And I'm going to go to this next chart because this really gives, really was startling when we pulled this data together. This is for 2016, and you'll see the first column is the different measures, and the RNA is a test that has to be done to make sure that the medication is going to work on the patient, the Hep C medications. But you have your national stats, our local GIs, and then this on the farthest right is our outcomes. And we're really pleased with the outcomes that we've had with this program where our patients have been able to get their treatment. The SVR is after 3 months, you test the patient again to make sure that they've been cleared of Hep C. So we had one or a couple patients that we weren't able to test after they had their treatment because they moved out of the area. But we are pretty pleased by this, much better than some of our community patients that get their services through the local GI. But I think that having the primary care provider there, the specialist, everybody, the benefits of telehealth are certainly there. Our mental health program, we do licensed clinical social workers between our sites, our visits, so that they can reach out to all of our sites. We do counseling through telehealth with other sites. The Institute for Family Health is an FQHC in New York City. They do psychiatry for us and counseling, and then of course we use St. Joseph's in Syracuse for child and adult psychiatry to help those patients out. We've had some really good successes with that program. We're trying to grow it because we have so much need. But just really, we've been able to keep people out of the emergency room, which really helped, speaks to DSRIP. We've had our PHQ-9 scores. We've had decreases in them. We've just really seen some nice benefits for our patients. And then the 17% of patients referred to higher level care, they were referred for inpatient further because they had some serious issues that need to be dealt with in a different setting than primary care. But all in all, a pretty successful program. This is our Telepeds dentistry. We've been doing this for a long time. We do this up with Rochester, and this has just been a phenomenal program. We've seen about 750 kids now since we started the program. We've been able to eliminate the trips to Rochester. We've eliminated the treatment time because our no-show rate is so low, and so they've given us a lot quicker access to their providers. 61% of our kids end up with in the operating room, 32% on nitrous, and 7% on local anesthesia for their treatment. But we have about 96% of our kids have gotten completed treatment plans, which means that they've gotten all their work done by Eastman, and they've also come back to their primary dentist and gotten their 3-month post-exam. And so our goal is to then get those kids into routine dental care through that program. So that's been really successful. We're really pleased with that. So, this whole program, we just keep building it and building it, trying to sustain it through, we don't get, of course, we can't bill for a lot of these visits, but, for our money, our return on investment is really important, and we think that it's going to be key as we move into a value-based world. So we really have pushed telehealth in our, and we get pushback. We still have problems with staff that don't. I just had a nurse the other day that said, I didn't sign on to do telehealth. She said, I can't do it. I don't want to do it. So you get pushback. It's really challenging working with some of the staff, trying to get them to accept it. But, we just keep trying to educate, but the providers love it. But most importantly, our patients love it, and we have good outcomes. So it's really been worth it to us. So thanks. Katie?
Thank you, Mary. That was excellent. Corey mentioned choosing you, and for a very good reason to present, because you have a program that many of the folks on the line should look up to in terms of sustainability and the patient satisfaction that you get. I think it's super interesting, most of all to me, the Telepeds dentistry is fantastic, because that is a new field that has very little, I think, data behind it. So the fact that you've had such success, over 90% with that program speaks volumes. And it's good to hear. One thing I wanted to ask you was if you knew anything about the regulatory modernization initiative that I was referencing in the beginning of the call, because I believe Ray Ann told me you might be a co-chair for the telehealth group.
Yep. So what we're looking for is to have people, you were right, the first one September 5th in Albany, and the second one I think is the 27th of September in Buffalo. And they're from like 10 to 3, and they actually have to go live to testify, or you can send in writing case studies or that explain how a regulatory or statutory rule is impeding the ability to provide that service via telehealth. And we are really hoping to get as many people as possible to testify or to send in statements, and I'll have someone else in the group testify on their behalf. because I think that the only way that we're going to really move this mountain is to get real life stories. I don't, no offense to the folks in the government, but we need to hear from the people that are actually providing the services, where there's barriers, where there's hiccups. So I am encouraging everybody, if you want something to be stated or you have a regulatory issue that you think we need to focus on, please, please, please feel free to send me something or come and testify, sign up to testify, because we really want to hear from those folks. And I'm hoping that this is now, I know there's only 2 meetings with us, I'm hoping we can continue this conversation even after those 2, because this is, we're taking on a huge task, and we're not going to fix any of this in 2 meetings, but we really want to hear from everybody. So please feel free to reach out to me if you have any questions or thoughts or ideas. We would love to hear them.
Excellent. Yeah, a few folks messaged me and asked if we could explain a little bit more about that. So thank you for providing some clarification, and I'll put that in the agenda. I'm going to try to be there in Albany listening in the audience, because Ray Ann said folks could come and listen. So I think that will be at least a good opportunity to be there in person. And yeah, that's it. So thank you. Mary, can you send me your slide deck? A couple of folks asked if they could receive the presentation.
Yep, I will send those out for sure. I'll send those up to you, Katie.
Okay, thank you. All right, moving on. I did get confirmation that there are no updates from the Office of Mental Health at this time. I am waiting to hear from OAFAC, because there is someone on the line to see if they have an update on their telepractice standards and when those might be released. But for now, I'm going to move to our next agenda item. So, you know, good news and bad news to share. Most of you on the call likely already know that David Johnson has left Fort Drum to pursue another opportunity, but the good news now is that you all have a fantastic resource taking over this critical role in the Watertown, Jefferson, Lewis, Oneida, St. Lawrence area and providing access to care for your patients. So Bob Hunt will be taking on the role as the Telemedicine Network Program Coordinator, and he has extensive experience with telemedicine, fiber networks, USDA and FCC broadband funding, and many other areas related to telemedicine. Bob is currently Fort Drum Regional Health Planning Organization's Fiber Network Manager, and he was instrumental in the North Country Telemedicine Project, which actually built our regional fiber optic telehealth network. And that initial deployment connected 28 healthcare sites, and in 2014, the North Country Telemedicine Project increased member locations by 42. And he now manages the Action Network, with which some of you may be familiar with. The Action Network spans the northeastern portion of New York, and together the 2 fiber networks encompass almost all of upstate and northern New York. I'll be sending out his contact information, and you know, Bob, you're welcome to say a few words if you'd like. Otherwise, I think I did a good job introducing you.
Yes, thank you very much, and I appreciate the introduction. And again, if any of you have any questions or concerns, my information will be published at the end of the call, and I'd be happy to talk with any and all of you. Thank you.
Wonderful, thank you. All right, so a brief update on what we have going on. As you all see on the agenda, I recently listened to a Reach Health webinar on telehealth legislation, and I'll send these notes out to the group, but there are some really interesting bills and acts that have been proposed to Congress and the U.S. Senate, and I wanted to touch on a few of those. Just to get started, I'm just going to bring back up the agenda quickly and share my screen. So a couple of the big ones were the Connect for Health Act of 2017. This act would expand telehealth platforms in ACOs, Medicare Advantage, home dialysis, and stroke treatment programs. It will expand remote patient monitoring programs for those with chronic conditions. It will expand telehealth and RPM programs at community health centers, rural clinics, and for Native American populations. And it will grant the Department of Health and Human Services the authority to lift restrictions on telehealth, including the current geographic limitations, originating site restrictions, reimbursement limitations, and restrictions on the use of store and forward. So that is a really big act that we're hoping Washington will, get behind. A few others, there's what's called the FAST Act, Furthering Access to Stroke Telemedicine Act, and this bill addresses only telestroke services and increases access to telestroke services by amending a specific aspect of law to allow for Medicare reimbursement. Another big one was Chronic Act, or Chronic Care Act, which stands for Creating High Quality Results and Outcomes Necessary to Improved Chronic Care. This was passed unanimously by the Senate Finance Committee in May, and this bill is pretty powerful and thoughtfully developed. It seeks to add the patient's home without geographic restriction to the list of originating sites for monthly telehealth assessments. It seeks to eliminate geographic restrictions on telestroke consultation services and gives ACOs more flexibility to use telehealth services. And then I'll touch on one more big one. The HEART Act, which was introduced in May, stands for Helping Expand Access to Rural Telemedicine. This bill seeks to eliminate some of the existing barriers to Medicare coverage for telehealth in rural communities, expand coverage to rural health clinics, and provide for Medicare coverage of RPM services for patients with CHF and COPD. There are a few more bills that are on the list that I'll send out to everybody, but the webinar was quite interesting. I'll send a link to it for anybody who wants to watch it themselves. I am getting the sense that there's a lot of pressure on CMS to relax some of their guidelines, so I'm certainly hopeful in the future that that will change and that we'll see some looser restrictions, because right now, as we all know, Medicare doesn't reimburse for quite a bit of services when it comes to telehealth. So we're really hoping that that will change. And then moving down my list, just a reminder that the North Country Telemedicine Conference is coming up on November 2nd. We're really hoping that everyone on the call will join us in person. The agenda is, 99% finalized. It's available on the North Country Telehealth Partnership website as well as the AHI website. We have an exciting panel put together after lunch with a couple of folks from not only the Department of Health, but also the Office of Mental Health and OASAS. So that will be exciting. If anybody has questions for that group, I would appreciate it if you sent those to me ahead of time. We want to make sure we get the most out of their hour of speaking, and there's 6 of them on that panel, and likely to be a significant amount of questions. So any way we can streamline that would be wonderful. And last but not least, just touching on an idea that I had last month, was creating a sort of Spoken Hub site needs service or job posting board. I've gotten a lot of information on what people need, but unfortunately not too many providers who are willing to, provide services, and, understandably so. One particular area that I have a provider who's, willing to provide services is an ICU program based out of Albany. Basically teleintensivist work. So if anybody on the line wants to hear a little bit more about that and what this provider has the capacity to provide, please email me separately and we can talk further about that. Other than that, I haven't had too much come up. So again, anybody on the line who is in need of certain services that telehealth can address, or has a provider who is willing to extend their service offerings to electronic means, please email me so that I can connect you to many of our partners who are in need of those services. That's what we do, is try to be that connective tissue, if you will, in the region to make sure that telehealth grows. And that is the last update that I have. Corey, do you have anything?
No, other than, you know, like I said, to welcome Bob aboard. He's been a huge asset to the region, and I just can't say enough how fortunate we are for him to take up on this role on the FDRHPO side and collaboratively with AHI. You know, I think it's really going to be a boost to the program, and you know, really warm welcome Bob aboard, and glad we got a chance to introduce him to everybody.
Yeah, I do see a few questions in the audience. I unmuted Richard Schultz. If you had a question for anyone on the line.
I think there was, I had thought of something, but I think it was just answered, but thank you.
Oh, okay, excellent. And I see Andrew Solomon. I just unmuted you as well. Did you have a question?
Thanks, Katie. I was just going to mention back on your legislative update, I think that was an excellent overview. I thought I'd put a little plug. The CTEL, the Center for Telehealth and eHealth Law, has created a reimbursement coalition, and they are collecting any unpublished data, ROI data, from folks to deliver to the Congressional Budget Office. And they're on a pretty short timeline. They're trying to get all their data by September, by the end of September. But their goal is to try and provide some more data so when CBO scores some of these bills, they can hopefully determine if they're cost savings or cost neutral, because it sounds pretty unlikely that any of these bills will pass if they don't come out positively like that. I also like to just put in a little plug for CMS. You know, the legislation is critical because the current CMS Medicare regulations are written into the Social Security Act. CMS can't change the regulation or expand coverage until the Social Security Act is changed by Congress, with some exceptions to alternative payment models. But they really need the legislation to be able to do anything differently.
Yeah, you're absolutely right. And one of the notes I made on my paper here was that these bills are more likely to pass as pieces of larger must-pass legislation, such as the Social Security Act changing or the CHIP reauthorization, but there's certainly strong congressional interest in advancing telemedicine, just from seeing the amount of bills that have been proposed and seem to be moving forward in some ways. And I mean, even in our state alone, if you go to the Center for Connected Health Policy, they have a state-by-state guide of pending and current legislation, and there's, I want to say, at least 20 bills in the Assembly and Senate, if not more, in New York State alone that are looking to expand telehealth from a legislative perspective. So the interest is there, and I feel like we keep hearing this, and I keep saying this, but we're very much at a tipping point with telemedicine. So much like myself, you know, let's just be patient and try to ride the wave and hope that in the next several years, you know, we'll look back and laugh at these conversations because the landscape will have changed so significantly. Okay, I am not seeing any other hands raised or questions posed. So with that, I will probably end it here. I will send out Mary's slides to the group as well as meeting notes and a document of all of the bills I just talked about and additional bills, a link to the webcast that I was referencing from Reach Health, as well as a link to the recording for this very presentation. So if nobody else has anything, we'll wrap it up for the day and go out and enjoy the eclipse, hopefully with your protective glasses.
Thank you.
All right, have a good one, guys. Thank you.
Thanks.